hair transplant stands out among all the cosmetic surgeries because it gives you long-lasting results. Hair transplant doesn't fix the hair loss issue.
Okay.
It will fix the baldness issue.
Who should go for transplant? So what exactly causes the hair loss? Hi, I am Vineet Raina and right now I am at Eugenix Hair Sciences, which is located in Bandra, Mumbai. And I am with the co-founder of Eugenix Hair Sciences, Dr. Arika Bansal.
Welcome, Vineet, to Eugenix, and I hope you like the clinic and the overall facility.
I loved it. I am totally in love with this clinic and the hospitality and everything. Doctor, why I am here is I want to get my hair treated and I want to get good hair health, and I don't think there is any other place better than Eugenix. And as far as hair transplant is concerned, like Eugenix aces in this field. So can I ask you more about hair transplant?
Yes, of course. Yeah, you can ask
how is
questions.
How is it getting so popular, and what are the pros and cons, or anything that you want to share with me?
Right. So hair transplant is one cosmetic surgery which gives you a long-term result.
Mm-hmm.
There are other cosmetic surgeries people are doing, like liposuction or fat loss or other procedures, but all those procedures have a very short duration of result. Okay, as soon as the lifestyle goes bad, they tend to gain the fat more and they tend to lose all the benefits of the cosmetic surgery.
Exactly.
So hair transplant stands out among all the cosmetic surgeries because it gives you long lasting results. If you are taking a holistic care of your hair, then you can enjoy those hair for lifelong. So the problem is, in these days, the hair transplant becoming so rampant. The good part is people are able to address those issues of baldness and actually get a good remedy. But the cons is, even people who are not good candidates for transplant in early stages of hair loss, who in teenage and young people, they are rushing towards transplant as if it's a magic that will fix their hair loss issues.
Okay.
So hair transplant doesn't fix the hair loss issue.
Okay.
It will fix the baldness issue once the baldness has progressed to a considerable extent.
Okay.
That is one point that people should understand. There is nothing called preventive hair transplant.
Okay.
The transplant is a curative treatment.
Okay.
Now the good part is we do follicular unit transplant, so it looks totally natural. Okay, and the art and science is also put in. The results can be very, very satisfying and gratifying, both for the doctor who is doing the procedure and also for the person who gets it done.
Okay, doctor, the ultimate question: who should go for transplant?
Yes, so first of all, the age factor. People in their early 20s should not think of transplant. Instead, they should think of fixing their hair loss and preventing the progression of hair loss more than doing a surgery per se.
So there are ways to prevent the hair loss at the earlier stages rather than straight away going for the hair transplant.
Yes, absolutely. So what happens is, we are blessed with thick terminal hair on our scalp. So baldness doesn't occur overnight. Those thick terminal hair, they undergo miniaturization. The hair caliber keeps on reducing. They become thinner, and then they gradually disappear. So this process of miniaturization can be detected in early stages also. And these days people are very watchful for their hair volume and density, and they can also detect their hair loss in early stages. And if they consult the doctor at the right time, then yes, the problem can be fixed and further progression can be prevented completely.
And doctor, what exactly causes the hair loss? See, there's hair loss.
Yes.
And there is hair fall. So there's a difference between both of these terms?
So hair loss and hair fall is almost synonymous, but baldness is a situation where when hair loss has progressed to a very great extent, then they can have baldness. Okay.
And what causes it? Hair loss?
Most common reason is your genetics. Okay? So in men, what happens is they have a family history of baldness in their father or maternal grandfather or paternal grandfather. So they usually inherit it through their genes. Okay. Sometimes there can be sporadic mutation, and a person with no family history may still develop baldness. Now, the typical feature of male pattern baldness is it affects the front or the mid scalp or the crown, or sometimes all the three areas simultaneously. The back and sides remain normal.
So this area mostly remains the same. And mostly people lose the hair from the crown.
They lose the hair from the top. So the top portion consists of front, mid and crown. All the three areas. So this is a very typical feature of male pattern baldness, which is most commonly encountered these days.
So doctor, you think people are going for transplant for beautification also?
Yes. So what happens is people are doing the hairline lowering, and women also. So suppose female is there and who has no hair loss, but she is concerned about the wide forehead. So they are lowering the forehead also, lowering the hairline so that the forehead looks shorter. Similarly, in boys who have no baldness per se, but they have a wide forehead, they can bring the hairline down as a cosmetic enhancement also. But in men, we have to watch for the male pattern baldness also. If they have a family history, they should be. But at Eugenix, we emphasize is a holistic approach, not just transplant, but your overall lifestyle. Like your sleep should be adequate, your diet should be adequate. You should not be treating your hair with too much of hot air or hot water and any sort of harsh chemical.
So doctor, I think the viewers want to know that how safe is it?
So safety is of a very paramount importance to us also. So for safety, we make sure a person is totally physically fit. They should not be having very severe uncontrolled cardiac issues. If they are on some medicines for angioplasty or angiography, we make sure that all those medicines are stopped, especially the blood thinners, few days prior to the procedure by their cardiologist. Then if they have high blood pressure, it should be controlled. If they have high blood sugar, it should be controlled, and the glycosylated hemoglobin should be within the normal range. So they should not be having any uncontrolled pre-existing medical issues. All the medical issues should be actually treated properly and should be well under control. At the time of procedure, person should be totally physically fit. We don't put the patient to sleep, so we don't sedate them. So procedure is very, very safe, and it's a very superficial procedure also. But these days, what complications we can expect is like a person who has uncontrolled severe diabetes, and in the hurry to do the procedure, either the doctor or the patient, they forced to do the procedure, and then the patient can end up getting some infections. So that is something we should be preventing. The other thing is the setup. So we have to ensure the instruments are fully sterilized. We use the disposable syringes and all, and we make sure that the area is totally sterilized. So post-op care, the pre-op care, and the intraoperative care to prevent infection and ensuring the sterilization is the responsibility of the doctor per se, and the whole infrastructure of the center is responsible for making sure that the sterilization and hygiene practices are followed to the T, so that you don't develop any kind of post-op infection.
And I must assure the viewers that at Eugenix, all these things are taken care of to the T. So that is what Eugenix is all about. And doctor, I want to ask you one thing, that earlier it used to be a social taboo, getting the hair transplant done, because maybe people used to tease them. But people nowadays are more open about it. You know, they want to go ahead and get their hair fixed. I just want to ask you that who should actually come to Eugenix? Like all the parameters taken care of. The person is fit, the person is having the hair loss problem, and if they are going through all these problems, where they are they feel embarrassed going into the public with their receded hairlines. So when they are coming to the Eugenix, what should they expect?
So this is very important. Everybody's body is different. Everybody's scalp is different. Their hair quality, their density is different. So we have to do a very proper, thorough evaluation, and we should know that what we can expect from a hair transplant, which areas will be covered and which areas will not be covered. The areas that we are leaving out from the surgery, either they will improve spontaneously with medications, or we may not be having enough number of grafts to cover that area. So in people with advanced baldness, they should undergo the procedure in 2 to 3 stages.
Exactly.
A patient with complete baldness grade 6-7, their head size and head shape might be different from somebody else. So that's why we are sometimes providing a full coverage in a patient of grade 6 baldness just with 4 to 4.5 thousand grafts. Whereas another patient with same type of baldness but with a larger head size might need 7 to 8,000 grafts also. So that's why it is very, very important to know once you have made a decision from the procedure that what area is being operated upon, what area is not being operated upon, and the area where we are not doing the procedure, how that area will respond in future. So if we should have a backup plan, that if that area becomes bald in future, we should be able to fix that with another sitting of transplant. Sometimes we get requests कि area बहुत छोटा सा है but आप बहुत घना लगा दो, बहुत ज़्यादा लगा दो. In that case, the results can be counterproductive. If we put the grafts too closely, they may not survive. So a optimum distance should be maintained. So there are a lot of nitty-gritties in hair transplant, and we should pay attention to all those small points to ensure the best results with minimum number of grafts.
So if somebody comes to you, so you all should also think about it that if you are going to a doctor, please, don't, put in your demands कि मेरा ऐसा बना दो या make it more dense or something. Whatever the doctor suggests, one should go for it.
Yes. So we should know the inputs also. Inputs are very important because it's something which you are wearing. Your hairline you are going to wear for next 20 years. So your inputs are very, very important. And a lot of customization is possible. But then not everyone has the luxury of going for aggressive hairline. So we should go for a very conservative approach as much as possible, planning for a long-term future.
And one should treat their donor area like their bank balance.
Yes, it is actually a bank balance.
Effectively.
We call it a overall donor bank reserve over a lifetime. Varies from person to person. Average Indian people have a donor bank ranging from 5 to 9,000 grafts. But then we should be even if we don't need that much, we should be underplaying the numbers always.
And doctor, what kind of techniques you are using here in Eugenix for hair transplant?
So we are not doing the FUT technique, which was the strip technique where we extract strip from the backside. That was the technique which is still being practiced and which was the gold standard technique, I would say 10-15 years ago, where the strip was extracted and stitches were placed. The reason we gave up the FUT or the strip surgery is because it was more invasive. In our experience, so I will be strict that I'm not saying FUT is a bad technique, but in our experience, what we have seen with FUE alone, we are able to extract a lot of grafts even in patients with grade 6-7 advanced stages of baldness. Tweaking that we have done is in the sequence of procedure. We call it direct hair transplant. That's the only technique we are doing these days, where extraction and implantation is being done simultaneously, so that the graft survival is ensured. And we make sure that the roots are not touched. So because the roots are not being touched, there is no risk of damage, and that's why also the survival rate is very high.
So this is the most advanced technique to do the hair transplant?
So there are a lot of technological innovations happening at the same time. People are working on robots, and they are doing robotic hair transplants also, where the machine will determine the size of the punch and the angle of punch. So all those improvements are happening. But of late, in our experience, what we have found that the manual hair transplant that we are doing, the non-robotic one, gives better results than the robotic one. So, but a lot of technological innovations are happening, but not every technological innovation is associated with improvement. So what we do is we bring in the technology, and if we are actually convinced that yes, it adds value, even if a 1% improvement in patient's comfort or graft survival or donor cosmesis, then we actually incorporate it into our practice.
Okay.
But not all technological innovations and instruments are helpful. So that's why a continuous upgradation is required.
Okay, so that's why you said it has to be science and art together.
Yes.
Okay. And how does PRP help, doctor? Most of the people are going for regular PRPs. Does it really help for people for their hair growth, or does it dense the hair?
So PRP is very popular these days. In my own experience, I prefer it more for female patients because they are not very good candidates for transplant. It gives an improvement in density, a boost to hair growth, but that's very temporary.
Okay.
Once the PRP factors are metabolized, which is maybe 4 or 6 weeks, max to max 8 weeks from the date of PRP, the effects start vanishing. So we have to keep on doing the PRP again and again to maintain those effects.
Okay.
So it's not a cure for baldness, I would say, especially in men. Okay. But in women who are maintaining a very good healthy lifestyle, who just want a temporary boost in their volume and density, the PRP adds value.
So is it something like people do Botox? It's very temporary results?
PRP gives temporary results, just like Botox.
Okay. So I can assure you that if you are dealing with any kind of issue with your hair, you should better come to Eugenix and consult Dr. Arika Bansal. Doctor, you have one center here in Mumbai.
Yeah.
Where are the other centers located?
Primarily, we are located in Delhi NCR, which is in Gurgaon, which is very close to the airport, because that's the place where most of our international patients prefer to visit. But yes, we are maintaining a center in Mumbai. And then we are coming up in Hyderabad also.
Oh, wow. And I think most of the questions we have asked doctor, and I am not going to bother her for a long time now. So, doctor, any message for the viewers?
So my message is just keep on researching. Like for every decision in our life, we do a lot of research.
Exactly.
So same goes for transplant research, thinking about what exactly we want. Telling ourselves, talking to ourselves and knowing what we are going to achieve with the procedure, what we are not going to achieve with the procedure is very important. So people don't do that much of introspection and self-thinking and not getting their priorities clear. So that is very important.
Thank you so much, doctor, for this enlightenment. You know, I'm so much clear, and I think I'm gonna after all the advices that I'll hear from you, I'll take care of my hair more. Thank you so much.
Thank you, Vineet.